Hi, hi, my name is Tammy Boothby, and I just wanted to make this recording for anyone who, like me, has gone through bilateral mastectomy, chemo, breast cancer, breast reconstruction, um, had explant surgery for breast implant illness, and may be pursuing fat transfer and breast reconstruction um, in that way. So anyway, oh my goodness, I'm in the middle of all of it and just wanted to share. I had someone reach out to me asking what she could do to prepare for explant surgery and her first fat transfer. And I got to thinking about it like, I do have a lot I could share because my goodness, it's been a 19-year journey and I've learned a lot along the way. So I would love to share a little bit about my background and then just give you some tips that might be helpful to you. And I'm sure I could learn from you too, things that have worked for you. And I just wanted to, again, just let you know that we're in this together. And I have been blessed beyond measure by the community that I have, grown to get to know and love within this, a whole frame of breast reconstruction. It's so much, it's so emotional, it's heart-wrenching, it's hard, and you feel like nobody understands. Everyone just wants to talk about breast augmentation or something, which is great. I'm happy for anybody who wants that, but this is not that. This is breast amputation. It's devastating and it's been hard, and it's been such a relief to connect with other women who understand. So I just wanted to share my story. I am actually post-op right now. This is my 6th fat transfer. So they do liposuction, from here and put it up here to form breasts. So this is my 6th one. This is like a bandage kind of splint bra, they call it. It looks like an ace wrap, but they put glue on it and stuff so it like holds your shape. It's supposed to help like help the fat to stay in place and everything. But I mean, hello, it looks like I'm getting some shape here, so that's super exciting. But yeah, we'll talk about that in a second. But I just wanted to kind of share where it all started and how I got here and things that have helped along the way and things I've learned. And again, I would love to be in touch with you and learn from you as well. I was 27 years old in 2002 when I was first diagnosed with breast cancer. I thought I was so healthy. I was a runner, I was a vegetarian, and it was scary because my mom had been diagnosed with breast cancer when she was 28 and she died when she was 30. And so I was 2 when my mom died. My sister was 7. And so I don't even have a memory of my mom, but then to have kind of, the same thing happened to me, it was terrifying at the time. We did the genetic testing, it came back negative, which is weird, right? But because of my mom, we went ahead and did the bilateral mastectomy, reconstruction with breast implants, and 6 months of chemo. I went on to learn that only 10% of cancer is genetic and 44% is actually environmentally related. And that intrigued me because I just thought, oh my goodness, we're not talking about that enough. And so that actually led me to, the path of cleaning up everything in my environment, including, personal care products, cleaning supplies, that I'm sure you're probably on board with that too, just because I think, with breast implants and breast implant illness, you become so sensitive to everything too. It drove me crazy to learn that in the United States, the cosmetic industry is not regulated, so they can put carcinogens in personal care products. And you think about it, we're well aware that there's aluminum in deodorants, right? We're well aware that there's lead in lipsticks, but did you know there's formaldehyde in most mascaras? There's carcinogens in baby products, which I think should be a crime. Like, how is that okay? It's terrible, because we know what we put on our skin absorbs into our bloodstream and affects our health even faster than what we eat. So the more I learned, the more I just wanted to do better. And again, pass the word along to other people on the same path, looking for healthier options. So I actually learned about Arbonne way back in 2003 after I had gone through chemo, and I was looking for healthier, safer products. So I've been using Arbonne skincare and makeup and hair care and body lotion and deodorant and all the stuff for a really long time, because it's plant-based, it's cruelty-free, it's GMO-free, soy-free, sugar-free, all the stuff, gluten-free. And it's great for sensitive skin, and it like feeds and nourishes the skin, adds health instead of subtracts from your health. I mean, that just seems like a no-brainer to me. So I feel really happy sharing about that. So back to my story, I do want to talk about the Arbonne nutrition plan that really helped me. I'll get to that in a sec. So in 2002 and 3 is when I went through all my stuff. It took like 13 months to do the tissue expanders and breast reconstruction. It was hard. And once you're done, I finished, but then it looked terrible. It was all lumpy, bumpy. I had to like wear all this padding to just cover up, the reconstruction. So then 3 years later, in 2006, they came out with the cohesive gels, which maybe some of you have had those. And it's like a thicker silicone implant made for mastectomy, people who've gone through mastectomy. So that was actually better, more aesthetically pleasing. I had another surgery to get those in. I just, it's like you think you're done, right? Once you finish all the reconstruction and breast cancer treatment and chemo and everything, you think you're done, but it was like there was a lot of cleanup to do. And I started going to an integrative doctor because I didn't feel good. He said I had a weak thyroid, I had adrenal fatigue, skin rashes, carpal tunnel, headaches, eye pain. I mean, you name it. I, started gaining weight, all this stuff. And it was like, what is going on? And I felt tired all the time. I just could not like shake feeling tired. I'm trying to work and, live your life. And I just figured it was because of chemo, but, here I am taking counterfuls of supplements and giving myself vitamin B shots, and like nothing was working. And finally in 2017, my doctor said, Tammy, I don't know what to do for you, but you're headed for liver failure. What? What do you do with that? I didn't drink, and it's just like, I'm trying to be so healthy, but my liver enzymes were elevating and we couldn't figure out why. I had put on 30 pounds and, I'm exercising all the time, eating like so clean. And there's just no reason for weight gain except for inflammation, and something is wrong. I ended up going to a traditional Chinese medicine practitioner. Her name is Shui Chen. She's amazing. And she was the first one to like alert me to there's something with these breast implants. And I'm like, yeah, they've been in there a while. I should probably get them changed out. She goes, no, they're leaking into your body. And I started thinking about that because, of course, we're told that they're safe for life, that it's in your head, all these symptoms that you're experiencing, it must just be in your head and stuff. And so I started digging in and learned about breast implant illness and all of that, and found the Facebook group Breast Implant Illness and Healing with Nicole, with 100,000 women, all with the same symptoms. Oh my goodness. So that took me on the path of needing to have explant surgery, which I did in August of 2019. Felt instantly better. I started having like daily nosebleeds, and again, eye pain, headaches, carpal tunnel, chest pain. My chest skin was like mottled and purple looking. I mean, it was time. Like there was definitely something wrong, along with the elevated liver enzymes and stuff. Immediately the day of explant surgery, I felt better. Like my headache was gone. I felt clarity. My carpal tunnel feeling was gone. I ended up losing those 30 pounds within like 6 weeks time. It just fell off of me because I didn't have that, constant infusion of toxins, because the silicone implants or saline implants, whatever you have, they're porous. So those carcinogens and neurotoxins it's like a constant infusion of toxins going into your system. And so, yeah, that's why so many women with breast implants end up with autoimmune issues, because we're just overloaded with toxins that we can't take care of. And I've learned too that women with the MTHFR genetic mutation are more prone to breast implant illness. So that's just another fun fact. And all of Arbonne's products are methylated folate, so they will be able to be absorbed by someone with MTHFR. So that's cool too. After explant surgery, my liver enzymes normalized too, like, within 6 weeks as well. So with all that being said, I'm so glad they were out, but it left me, concave and disfigured, and I felt like I just had an amputation, and nobody prepares you for losing a body part. I had actually just lost my sister to breast cancer as well. Devastating. So when I looked at myself, it just kept reminding me of my sister, because that's how she looked when she died. She had bilateral mastectomy too. And again, not genetic. I ended up finding out that we grew up near a nuclear weapons facility. This was outside of Denver, Colorado area. And there was a nuclear weapons plant called Rocky Flats. You can go on YouTube and learn about it, but it made the plutonium triggers, which is the heart of the atomic bomb. And plutonium is radioactive. It's the most radioactive substance on Earth. Oh my goodness. And because of all these safety code violations, the plutonium was going into the groundwater, it was going into the air, and a 30-mile radius of people were unknowingly exposed to this war-grade deadly plutonium. Like, oh my goodness. I actually went and got tested, and I did have plutonium in my system. We did a lot of the stuff at, again, the integrative doctor's office that didn't work, including chelation, which is the big guns. And again, my doctor was like, I don't know what to do for you, Tammy. I've never had someone with something radioactive in their system. And that's when I did the Arbonne 30-day plan. And I'm not making claims. I know my situation is unique. And everyone's situation will be unique experience. But for me, doing this plan and getting off the foods that are inflammatory and supporting my elimination organs and, building up my gut microbiome, my gut bacteria, it helped get rid of the plutonium, and my body was able to get rid of the plutonium, because I truly believe that there's no selective healing. If you, increase your nutrients and can facilitate toxins out of your body better, your whole physical self will improve, so there's no selective healing. If you can feed yourself better food and clear out the garbage, everything will improve. And that's what happened. And so that's something I'm like super passionate about. I had someone ask me, what can I do to prepare for surgery? I believe with all my heart, you can, strengthen your body by adding nutrients and taking out the toxins, taking out the garbage, right? And so again, something I learned through this plan is that, anything that we ingest, so that could be through what we breathe, through what we rub on our skin, or through what we eat, if it can't be used as energy to fuel the body, it's actually stored as a toxin in your fat cells, because the fat cells kind of protect your major organs. It keeps it away from the major organs and, protects yourself. So you think about it, a lot of people will lose weight with calorie restriction and stuff, but then they have the rebound effect and they gain it back and then some. And that's because they didn't get rid of the toxins. Same with my experience with breast implants. Once I got the breast implants out and that constant infusion of toxins, I was able to shred the pounds too, without even trying. It was crazy. So anyway, that's the biggest piece of this program, is every single product that is part of the 30-day set will help facilitate and support your elimination organs. Also, it helps, your gut biotics and bacteria, and it reduces inflammation and it adds nutrients to your body. So I love that. And it's something I would recommend to everybody. No matter what, whether you're getting ready for surgery, whether you've already had explant, whether you still have breast implants, whether you don't, whatever. Just if you just want to feel better, you will. And right now for me, I had surgery, not even 2 weeks ago, and I just feel tired. I feel good. I'm moving around. I'm, still swollen and bruised and stuff from the liposuction, but I feel good. I just don't have that energy. You know what I mean? Because I think every time I go through anesthesia, my stomach is like little crummy tummy and I'm bloated. I don't feel good, so I'm trying to, again, like cleanse my body and support my gut health and everything. And that's what Arbonne is helping me do. So I guess I'm here to see if anyone wants to join me in doing this 30-day plan, and or at least have another conversation about it. And I just wanted to kind of go through real quick what it's all about. There are products in a set that are all, at like 50% off. And it goes along with clean eating. So it's not about starvation. It's not about, a liquid diet or anything like that. It's just, good food with good supplements as well. So what I love is we also have a Facebook group that gives you recipes, meal plans, grocery list, treat ideas, snack ideas. Oh my goodness, everything. A daily nutritional post, like what kind of salt is the best for your body? Why is gluten not good for us anymore? What have they done to it? Why are GMOs so toxic to the body? It's all the why behind, what we're doing. So I love that. So with the kit, it comes with 2 bags of this protein, and it's dairy-free, gluten-free, soy-free. It has less than 1 gram of sugar. It is 20 grams of protein, so high protein, low glycemic index, certified, so it keeps your blood sugar stable. I love that. It totally takes away my sugar cravings too. Oftentimes, my boyfriend and I like to make what he calls the protein sundae. So you just mix it up like a pudding. And instead of like a shake to drink, you mix it like a pudding, and then you can put on, we like macadamia nuts and blueberries or whatever, you can do your toppings, coconut shreds, whatever you like, but it's like a protein sundae. So we have the protein oftentimes for dessert a lot of days. You could do a shake. I like having a shake in the morning too. For breakfast, or you can add a couple scoops of the protein, like the vanilla in oatmeal, with blueberries, that kind of thing. Or you can make protein pancakes. There's all kinds of things you can do with it. You can make like a, what do you call them? Like a smoothie bowl kind of thing. So anyway, there's all different ways to get your protein, but I love having it in the morning because it keeps your blood sugar level throughout the day. And when your blood sugar is level, you actually sleep better at night. So that's good to know. So in the plan, you get two of the bags of protein, and we have chocolate and vanilla and coffee flavor too, which is delicious. And again, all like full of nutrition. So it has all those vitamins and minerals as well. So I love that. Then there are these little stick packs of gut health, and this is a pre and a probiotic with 11 digestive enzymes. I just stick it right in my shake, or I'll stick it in water, but this, again, it's so important to nourish and feed your gut. You cannot ever get enough pre and probiotics. I love having these in my purse in case, you go out to eat or something. And if you're prone to indigestion or bloating or acid reflux, it's amazing. This is a miracle. So we also have energy face sticks. And so this is something, another stick pack you just pour into water. It kind of bubbles up at the top, so leave a little room But this is my replacement for coffee. I used to drink, my body weight in coffee, but I never really felt awake drinking coffee. I still had brain fog. I just had a rapid heart rate too and felt jittery. Whereas this, it actually clears your brain. I swear, it makes you happy, and you're just able to think clear. It has B vitamins, green tea, chromium, CoQ10, rhodiola, like, oh my goodness, it's all these nutrients versus stimulants. And I always tell myself I can have coffee anytime, but I just feel better drinking fizz. And so I'll have probably 2 or 3 or 4 fizz a day, and they're delicious. And again, it's more alkaline. It's very alkalizing versus coffee, which is very acidic. And we know that when our body is acidic, we tend to be more tired, and it's like a magnet for illness and sickness, So when you're in a more alkaline state, you're less inclined to get sick. So that's good to know, right? And then we have our greens. This is something you can add to a shake or just do in a shot. A greens shot with water is 37 fruits and vegetables all in one scoop. And so they recommend having 6 to 10 different variety of fruits and vegetables a day. If you're not a person who can do that, this will help, fill in the gaps for that. And then we have a 7-day body cleanse, which I'm drinking right now because, again, it's helping my gut feel better after surgery. And this is something I would highly recommend if you have a surgery coming up. Just start it the week before, do another week the week after surgery. I'm going to do like 3 weeks in a row just because it helps. It has aloe in it, and it really helps your liver. It helps your gut. There's just something about it. It settles my stomach. And so it tastes like lemonade. It's not something, you just drink it throughout the day along with eating. So there's no starving or anything, but it really does help everything. So that's something that you can get in your set as well. So that's the 30-day set. And again, there's all kinds of deals and everything, but it's meant to have enough. Oh, and then there's detox tea as well. I forgot about that. There's detox tea that helps support the kidney and liver. It also has the dandelion, milk thistle, licorice. Oh my goodness, I think there's 9 different botanicals. So good for you and delicious. Fennel, I forget all the ingredients, but anyway, it's delicious. It takes away the bloat, supports kidney and liver, and yeah, it does everything you need it to do. So at pre-surgery and post-surgery, it really helps with the bloat and swelling and all of that, just icky feeling. There's a couple other things I wanted to share just exclusively for people going through everything we're going through. One, there's a skin elixir product. This is, again, a powder stick you can put with your greens, like in a shot. And it is something that helps to build your collagen and elastin, and helps with healing and scarring. It helps with joint pain, all of that. Something that I've found with breast implant illness, your hair thins, but since I've had the breast implants out and I'm using this collagen, it's like I have all this baby hair growth, which is so cool, right? So it's just cool to, again, know that your body can restore and renew itself, when it's given what it needs. And then for like right now, because of this splint thing that I have on, I'm not able to shower. So it's been a week so far. I have like 12 more days to go. Lots of essential oil. But these, Arbonne has these wipes, which are, again, plant-based. It's like rose water. They smell so nice. But it's like baby wipes, baby wipe everything, and it works. You can take your makeup off, all of that. This is another product for healing. It is the skin conditioning oil. It's just a tiny little tube, but a little bit goes a long way. It's like 18 different oils in a blend, and it is a replacement for triple antibiotic ointment, if that's something that interests you, because the Neosporin and stuff has petroleum in it, so it's not great for you. This, I feel, is so good for wound healing. In fact, the University of Michigan actually used this for the burn unit and to help, repair burned skin. Another thing that I love is, oh, I wanted to show you. Arbonne has amazing skincare. I've used it for a long time. There's an anti-aging line. We know that aging is a privilege, right? That not everyone gets to experience. So I'm all for aging. However, I want to age beautifully, right? So this is, you know, one of my secrets for aging beautifully, this plant-based skincare set. It is made for, you know, building collagen and elastin and everything. And it is cleanser, toner, serum, night cream, day cream, and eye cream. It's beautiful. Of course, the sets, you know, have more of a discount, but you can piece it out if you need to. And then this is just like kind of a boost edition is this Derm Results Duo. It's an exfoliator pads, and this is a 15% vitamin C drops, which I've been using on my face, but I've also been using on scars, and it's amazing how much like of a lightening effect it has. And so if that's something you're interested in, it's like, it's really potent, but really good at like deep healing. So, you know, great for sun damage, any of that. And then one last thing I wanted to share is this. It's like a nourishing facial oil. And it's great, like if you're in extreme, you know, weather or whatever, or if you just need extra hydration. I know a lot of times with any kind of liver issues, you end up having really dry skin. And so I love, it's just super hydrating if that's something that you're looking for. And of course, Arbonne has masks. Oh, I wanted to show you, there's a detox mask. It's like a clay mask that, again, my traditional Chinese medicine practitioner actually recommended I use to pull toxins through the skin. She says, Tammy, and I haven't been doing it with this thing on, but before, and once I get this off, I'll go back to putting this clay mask on my chest just to help pull any more toxins out, you know, residual from the breast implants. And then I put it on my face too. Anyway, I forgot to bring it out, but I would highly recommend that as well. It's called Rescue and Renew clay mask. So those are some things that I was just thinking about for the person who asked me if I had any recommendations for someone getting ready for surgery or detoxing from breast implant illness, or just wanting to rebuild after everything we've all been through. But more than anything, I just wanted to connect with you and let you know you're not alone. And I really believe in you know, getting the word out about breast implant illness, and that women just need to know there's more options than just breast implants for reconstruction. And just a side note for Dr. Roger Corey, who is at Miami Breast Center, check out their Instagram page because he has tons of before and after pictures, which are so compelling. But he is one of the very, I mean, I don't know any other surgeons who do such beautiful work for people who've gone through radiation. So radiated skin is very hard to repair and rebuild, but he has invented this whole system with, it's an external, what is it called? External expansion, vacuum expansion, the Eve device, and putting suction, it's kind of like cupping, you know, but on your, you know, breast area. So it's like having this suction, this constant suction, it actually brings more blood flow. And it's so fascinating because I get kind of emotional about this, but it was, you know, 18 years of being numb, and I'm starting to get sensation back. It's like, it's so crazy that, you know, this device has helped just get us back to where we were, you know, get us back what we lost. And so not only does it help restore sensation, it helps expand, you know, your tissue so that there's a space for the fat to go in. It also will help heal and bring blood flow to the radiated skin, and helps with reconstruction. So if anyone has had radiation, I have several friends who have also had radiation. I did not, but I have several friends who are very willing to talk to anyone who has questions about reconstruction, and they're willing to show their before and afters and talk them through what it took and what their experience was. So I'm all for connecting and helping women just you know, get through this and love yourself through it, because it's hard. It's hard. And I'm proud of you for being in the thick of it and having the courage to, you know, invest in yourself and do what you need to do to, you know, feel good again. So thank you so much for tuning in. And yes, I look forward to hearing from you. And you can always reach out to me. I'm so happy to talk on the phone or connect in any way and answer any questions. I'm all for giving resources. I'm not about, you know, I'll never tell anyone what to do, but I can give you lots of resources so that you can make better decisions for you. So I think that's something too that has been lacking in this whole world. You know, this whole world of breast implants is informed consent, you know. So that's what I like to do, is just give lots and lots of information so that you can make the best choice for you. So, all right. Thank you for joining my TED Talk. Love you guys and appreciate you. And I can't wait to connect.